Today I'm going to be talking about a treatment for obsessive-compulsive disorder called exposure and response prevention. We'll be talking about what it is, how it works, and what makes it so effective against OCD. Hi everyone. In today's video, we're going to be talking about exposure and response prevention, which is widely considered the gold standard for treatment for OCD. But before I get into that, just want to go over a couple of disclaimers. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a substitute or replacement for advice from your doctor or mental health professional. Now, with those things out of the way, let's talk about exposure and response prevention. So, in previous videos, I've talked a little bit about the definition of obsessions and compulsions, and I've talked about a model for understanding how OCD works. Now, it's really important to understand those things, and if you haven't already seen those videos, I'd strongly encourage you to take a look at those videos first before watching this one, because the whole purpose of exposure and response prevention and how it works really comes directly from an understanding of what's going on in OCD. So if you haven't seen those videos, I'll put a link above and in the description below so you can take a look at those. So in order to understand how exposure and response prevention works against OCD, I want you to consider what exactly is going on in terms of anxiety and anxiety levels that occur within OCD. So we'll use contamination OCD as an example, but this process works for pretty much any type of OCD, be it harm OCD or relationship substantiation OCD, symmetry OCD, religious OCD, any of those types of OCD. They all kind of work in the same process and work in the same way. So imagine what would happen if I have a fear of contamination. And think about what's occurring with my anxiety in this situation. So I touch a doorknob and I think to myself, I get the obsession that my hand is now contaminated, that there were germs on that doorknob and they've now contaminated my hand. What do you think's going to happen to my anxiety in that situation? Right? I feel my hand's contaminated. It's going to make me sick. I could potentially pass that contamination on to other people, and it could make them sick. What's going to happen to my anxiety? Well, my anxiety is going to go up. And it's going to go up until it gets to this really unpleasant level that I'm very uncomfortable with, and I feel like I have to do something to eliminate that feeling. And so what do? I go and I wash my hands. Now, washing my hands has eliminated the contamination. So what's going to happen to my anxiety? Well, my anxiety is going to go down. So the act of washing my hands, the act of engaging in the compulsion has actually been reinforced by reducing my anxiety. So that's good, right? Well, not exactly. Because the next time I touch a doorknob, what's going to happen? Well, my hands are going to feel contaminated. So what am I going to have to do? Well, my anxiety is going to go up. So what I have to do is I have to go wash my hands in order to eliminate that feeling of anxiety. And so when I wash my hands, my anxiety goes down. Next time I touch a surface, my hand feels contaminated, my anxiety goes up, I have to wash my hands, my anxiety comes down. And so on and so forth. And so this is what's happening. You have these obsessive thoughts that are triggered by me touching a doorknob or touching a surface. It causes anxiety, so I have to engage in the compulsion to eliminate that anxiety. So this is what we call the roller coaster method for dealing with anxiety. So you have these ups and downs. So something happens, my anxiety spikes, I engage in a behavior, my anxiety comes down. So the compulsions work because they give me a temporary state of relief from my anxiety. And so that temporary state of relief feels good. So that's what I have to do every time I feel this level of anxiety. But the problem is, it's not actually helping eliminate the OCD. In fact, it's making it worse because every time I engage in the compulsion, I learn that engaging in the compulsion is the only way to eliminate the anxiety. And the thing is, this roller coaster approach can happen within a matter of minutes or even seconds. Right? So I wash my hands, my anxiety comes down, but then as I'm leaving the washroom, I think to myself, well, did I wash my hands well enough? Did I actually get the back of my hands? So my anxiety goes up, so what do I have to do? I have to go back to the sink, wash my hands. As I start to leave, I think to myself, did I really wash my hands, or am I confusing it with the first time I washed my hands? My anxiety goes up, and I have to go wash my hands again. So what can happen as OCD progresses is that engaging in the compulsions can actually lead to even more anxiety, even though the purpose of the compulsions is to reduce the anxiety. So we're stuck in this roller coaster method of dealing with anxiety and OCD. And so this is where exposure and response prevention comes in. So the thing about exposure and response prevention is the entire treatment protocol is described in the name of the treatment. So the way exposure and response prevention works is you engage in exposure to something that's going to bring on the intrusive thought, and then you prevent the response. You prevent the compulsive response, in this case, the hand washing, and see what happens. So I want you to imagine the exact same scenario. I go and I touch a doorknob and I get the intrusive thought that my hand is contaminated and there's germs. And so my anxiety goes up. But now this time, instead of engaging in the compulsion, engaging in the hand washing, I resist the urge to do that. I prevent myself from washing my hands. Well, what's going to happen to my anxiety? Well, my anxiety is probably actually going to go up even a little bit higher than before because I haven't engaged in the hand washing to eliminate that fear. So my anxiety goes up a bit more. But the thing we know about anxiety is that it can't keep going on forever. It's not like my anxiety is going to go up and up and up and up and up until my head pops off. At some point, the anxiety is going to plateau. It can't go on forever. It just physiologically, it's going to wear out. And so it reaches a plateau, and then gradually over time, it comes down on its own without me having to do anything about it. And so what's happening is the anxiety spikes, it plateaus, and then as it levels off, it starts to go down on its own without me having to do anything. I don't have to engage in the hand washing in order to make the anxiety go away. But this process takes a lot longer than it would for me to wash my hands. But then what would happen again if I did that a second time? So I touch a surface, I feel my hands contaminated, my anxiety goes up, but I don't do anything about it. It plateaus and it comes down. And if I do that again and again and again, what we know happens is that the level of anxiety doesn't go up quite as high, and that the length of time it takes for the anxiety to go away shortens and reduces. So you end up with what I call the rainbow approach for dealing with anxiety. So the anxiety is going up, but because I'm not doing anything about it, it's plateauing on its own and it's going down. And the more you do this, the less the anxiety goes up and the faster the anxiety goes away, until eventually you're at a point where you can engage in the behavior. I can touch a surface. I may get the intrusive thought, but I'm not going to do anything about it because the anxiety is not going up very much and the anxiety goes away by itself. And so this rainbow approach for dealing with anxiety takes a lot longer than the roller coaster approach, but in the long term, it really is effective in terms of me not having to do anything to eliminate the anxiety and for the anxiety to no longer be there with these behaviors. So exposure and response prevention is engaging in this rainbow approach for dealing with the anxiety. And so when we're doing exposure and response prevention, the idea isn't to start with the things that make you really, really anxious, right? So if I'm fearful of contamination, I'm not going to go and rub my hands all over a public toilet seat, because that's just going to spike my anxiety way too high. Where I may start is with cleaning a countertop in my kitchen, knowing that I've cleaned the countertop, and then touching that surface. That might cause me to feel a bit anxious because maybe I didn't clean the countertop well enough, or maybe there were still some germs left over. So I feel a little bit anxious, but not really high levels of anxiety, but I don't do anything about it. And I allow the process of this rainbow approach to take place. And then when I've done that level, when I'm comfortable with touching the countertop after I've cleaned it, maybe what I do is I don't clean the countertop before I touch it. And then allow myself to go through that rainbow approach as well. Once I'm comfortable with touching the countertop without having to wash my hands, maybe I go to my front doorknob. And so you essentially create a ladder or a hierarchy of these exposures, starting with exposures that might be a little bit easier, and then working your way up all the way to exposures that are a lot more difficult and a lot more anxiety provoking. And as you do this, as you go up each step of that fear ladder, you gain greater confidence, and you get to see that this process of experiencing anxiety but not having to do anything about it, that it works. And so you have less and less driving the OCD because you're not engaging in the compulsions, and eventually the obsessions go away on their own. So exposure and response prevention, it's widely considered the gold standard for treating OCD. It's a really effective treatment, but the key to understand is that it is really, really challenging to do, because what it requires you to do is to tolerate a lot of discomfort. It's to tolerate a lot of anxiety and to do nothing about that. And that doesn't feel good, but if you're able to do the work and you're able to engage in the therapy and do the exposure and prevent the response, over time, it will help reduce and eliminate the OCD. So yeah, it's a difficult treatment, but it works. So I liken this a lot to those old Buckley's cough syrup commercials, where the tagline was, "It tastes awful, but it works." You can apply the same to exposure and response prevention. It tastes awful, but it does work in terms of helping reduce and eliminate OCD symptoms. So I hope that all makes sense. I would love to hear any thoughts or questions you have about exposure and response prevention for OCD, so you can leave me some comments in the comments section down below. If you've been enjoying my videos and would like to see more, please hit that subscribe button and notification bell, and you'll be alerted every week when I post a new video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.